Welcome to Understanding How to Navigate the Health System, a Guide for Citizens. This is Module 6, the conclusion. My name is Christina Madison, and I'm a scientific lead as a McMaster Health Forum, and I'll be walking you through this module. This course was developed to help citizens understand the Ontario health system. The modules are designed to address how care is delivered in Ontario and the building blocks upon which the Ontario system is based. By better understanding your health system, you are in a better position to advocate for changes to improve the health system. Everyone has a health-related concern, and we rely on the health system to address many of these concerns. Understanding the design and function of the health system will help you to get answers for your concerns and to advocate for change when necessary. Timely access to care has been improving in some areas. For example, home care, primary care, and some surgeries, albeit unequally across the province. While Ontarians are generally satisfied with the care they receive, care coordination could be improved, as could accountability and transparency. Most Ontarians will live longer, healthier lives than previous generations, although they do not exercise as much as the average Canadian. The amount of money spent on prescription and over-the-counter drugs for each Ontarian is among the highest in the world and continues to rise. The care across Ontario is structured basically the same for most conditions. However, some conditions have their care delivered differently. These include mental health or substance abuse problems, work-related injuries and disease, cancer care, and end-of-life care. The care across Ontario is structured basically the same for most treatments. However, some treatments are delivered differently. Prescription and over-the-counter drugs, dental services, and complementary and alternative therapies. The care across Ontario is structured basically the same for each person, but some populations have their care delivered differently. This includes Indigenous peoples, First Nations, Inuit, and Métis. Whether looking at health care in terms of condition, treatment, or population, the building blocks are the same: the places where care is delivered, and the people who provide care. There are important financial arrangements which are also important within the system. A key aspect of the health system is whether, how, and under what conditions citizens have a voice. This may include having a voice in your own care, for example through informed consent, how a program or service for your care is delivered, how the system which provides your care is monitored, and the values that drive decision-making in how your care is organized. In a previous course, we outlined how you can find high-quality evidence to help answer your health-related questions. Sources of evidence include one-stop shops designed specifically for citizens, like the McMaster Optimal Aging Portal. You can combine the skills outlined in that previous course with an understanding of the health system outlined in this course to better engage within the system and to advocate for changes.
Ontario health system leaders are increasingly recognizing the importance of creating ways for citizens' voices to be heard in setting direction for programs, organizations, and the system as a whole. One form of citizen engagement involves Ontarians' participation in boards of directors and in advisory panels, but the breadth and depth of such participation is uneven across the health system and often lacks diversity. Another form of citizen engagement is less formal and includes sharing concerns through a complaints process, advocating as a member of patient and citizen groups, and casting a vote in an election.
Thank you for taking the time to view this video. Please click Show More below the video to access additional resources and to access an evaluation. Please complete the evaluation by clicking the link. Be sure to visit the McMaster Health Forum's website at www.mcmasterforum.org and the Ontario SPOR Support Unit at ossu.ca. Access the companion course, Finding and Using Research Evidence, a Guide for Citizens, on our YouTube channel.